Good evening, all my colleagues, Dr. Leung, Dolores, and all the staff. Thanks for joining our monthly physician to physician call with Riverside County Public Health Officer, Dr. Geoffrey Leung, who gives us a COVID update. And then our colleagues have uh, sent the questions in advance. So the ones which we selected, we'll ask those. I'm sure he's going to address the latest development late today. Dr. CDC Director Dr. Rochelle Walensky, who was on TV saying anyone fully vaccinated can participate indoor or outdoor activity, large or small, without wearing a mask or physical distancing. So that is a big development today. I'm sure Dr. Uh, Luang will address that. So it's your stage, Dr. Luang. Please uh, give us COVID update.
Okay. Thank you so much, and good evening, everybody. Thank you for this time. So, first of all, that latest piece of news we think is very hopeful and optimistic. We think this is sort of telegraphing to where we want to be, but there are, of course, many questions of how to operationalize that right now. So we don't have many more specifics besides that statement. And we do know that states can theoretically do something that is more restrictive. Now, California has said that as much as possible, they want to align all of their guidelines with the CDC guidelines, but there is not a new set of guidelines out yet. The most recent set of guidelines that we have, of course, is slightly different and more conservative in that it states that those who've been fully vaccinated can be, in general, outdoors without a mask, except in sort of dense and crowded situations. That in mixed situations outdoors, that those vaccinated can also be without a mask, including things like eating outdoors. But in the latest CDC guidance that's been published, it still does say that indoor activities generally, we are recommending masks unless everyone is vaccinated in that setting. Now, as recently as yesterday, the California Department of Public Health has also said that, with their guidelines, they anticipate that masks will likely continue to be recommended for certain indoor activities, public transportation, and densely and crowded areas. So we'll also have to see, how our state responds to any formal and published guidelines from the CDC.
Thank you. And the question is, how will you know if the person is vaccinated or not? So it's very difficult how it's going to filter to the state and county level. So
right.
we'll have to. Okay, our first question is, what is the latest on schools? Do we expect a change in mask requirements, distancing, etc.?
So outside of the statement that was made this afternoon, what we've been hearing, at least from California Department of Public Health, is that, again, they were sort of anticipating that we would likely still have an indoor mask requirement within schools, although we are seeing a trend towards moving away from distancing requirements, as well as capacity requirements.
Okay. If our entire staff had been totally vaccinated, do we still A, need to wear masks indoor? B, have patients wait in their cars for their appointments? C, not allow patients to wait in our reception area? D, allow others besides patients in the waiting and exam rooms? And E, continue to use plexiglass barriers?
Yeah, so this is a great question, and I think we're actually just on the cusp of seeing a transition with many of these things. Now, for part A, if we're talking about a medical practice, the guidance is still for staff to wear masks indoors. If we're talking about a non-medical office, an administrative office, something outside of healthcare, theoretically, if everyone is vaccinated indoors and you do not have, there's not guidance specifically for that industry, There may be situations where people do not need to wear masks indoors, again, when everyone is vaccinated. For the other questions, actually, I think we are on at a transition point with each of these things. So, it probably, we're at a point where not all patients need to be waiting in their cars for their appointments. That was, that may have been the right thing or the thing that felt the safest at the beginning of the pandemic. But certainly, with a much higher percentage of the population vaccinated and a much lower case rate, the benefit of that would be much lower now. And there certainly has been a loosening to make it easier for patients to visit healthcare facilities. So, if we're thinking about our own clinics, allowing patients into the reception areas, with precautions would probably follow the general trend, as well as allowing other people, including maybe family members, to start coming in. But this would be at your discretion and within your comfort level. There's not guidance that sort of strictly prevents that right now. And then finally, with plexiglass barrier use, there are some different feelings about this, but in general, we will start to see that all the guidance forthcoming will probably not mention barriers.
Great. So that's all we have. It says, can you provide any data, links, and evidence to support your answer? You already did that. Number 3, with the changes in the vaccine rollout in the state, can you clarify the role of public health department in the current distribution process and describe what practices need to know about ordering vaccines for our offices?
Yeah, so this is a great question. So the first thing is we have a third-party administrator who handles the allocation of vaccine across our state. And so we often call that the TPA. And in order to provide vaccine in our county, you need to be an approved COVID vaccine provider through the state. So, that's a good place to start. And RCMA, certainly can be a great link and support. And then through the public health department, we actually do have also a community vaccine provider sort of support team. But if you are not already an approved COVID vaccine provider, that would probably be the first step to take.
Great. Do we need to enroll through the My Turn system, or can we work directly with the public health department to get the vaccine?
So first of all, the My Turn system, which is the statewide platform for scheduling COVID vaccines, you do not 100% have to use that, although the state would like everyone who can use it to use it. And then in terms of being able to work with the public health department, certainly, we want to be able to support all of our providers as much as possible. There have been many twists and turns, even during the past few weeks, because the original intention was that the third-party administrator, Blue Shield, would handle all of the allocation for all of the community vaccine providers by a certain date. Now that date has passed, and there have been kind of many exceptions, and they also do not want to disrupt the flow of vaccine. But we know from the state that they really want people to be a part of the network for the third-party administrator. They want them to be a part of the network in order to be sort of providing regular COVID vaccine, although there may be some exceptions that currently exist.
Thank you. Next question is, can the public health department provide written guidance in vaccinating children? What is the protocol for vaccinating parents of children who are not our patients, but waiting their shot at the same time?
So as of right now, as probably many of you know, Pfizer is now expanded to 12 to 15 years of age. So anyone 12 and up can receive Pfizer in our county. In terms of guidance for vaccinating children, we would refer you to the Advisory Committee on Immunization Practices. and they provide guidance on how to think about vaccinations and sort of the guidelines for that. In terms of a protocol for children or minors, we would recommend that you use the process that you typically use for other childhood vaccinations. And so certainly an acceptable route is having the parent accompany the child. What would not be acceptable is for a minor to come on their own to get vaccinated without any other consent or paper documents. The California Department of Public Health is also working on trying to see if there's sort of one common template that can be used, for parents who want to give permission and let their child go, to the doctor's office with another adult. And so when that comes out, we'll be happy to share that as well.
Okay. Our audience, please, you can write your question in the chat box, and Dolores will be happy to screen them. And at the end of our written questions, if there are any, we'll be able to ask Dr. Leung those questions. Next question is, can you provide any data on adverse events post-COVID-19 vaccines over and above the first 72 hours of symptoms experienced by 50% of those receiving the vaccine? A, is there anything notable when comparing one vaccine or the other? B, news reports in the last week have highlighted HSS data from the vaccine adverse event reporting system, which is tracking post-immunization deaths that appear to be directly related to vaccines. Can you put this data into perspective, please?
Okay, thank you. So, first of all, starting with adverse events following COVID vaccination, there is a wealth of information if you sort of look that up through the CDC website, and they actually have this data broken out by each vaccine and for each type of symptom. Now, for the most common symptoms experienced, really the only symptoms experienced probably by at least half of people would be arm soreness or pain at the delivery site. In terms of kind of vaccines with notable differences, I think we're still waiting for a better comparison of the Johnson & Johnson with Moderna and Pfizer. But at this point, what you've seen is in the news is probably the most notable. That with Johnson & Johnson, of course, we've seen these rare but serious blood clot events. And that tends to happen in women under the age of 50. Otherwise, the other events seem to be very rare. And of course, the blood clots are rare as well. And then in terms of the VAERS data, what we would say is the data that they're tracking and collecting is probably more robust than any vaccination data we've collected previously. And the number of deaths kind of following vaccination are remarkably low. If you take a look at some of this data, it really includes everything. And so you have to factor in what is a normal rate of heart attacks or strokes in the common population, and then how does the rate of reporting compare to that baseline. I think what we hear about in the news is about any trends that are above that baseline, which is why we tend to hear very little about this, except for the recent rare but serious blood clot events.
VAERS means Vaccination Event Reporting System. Our next question is, one of the strongest antidotes for vaccine hesitancy is to engage family members and medical providers to be the champions in encouraging COVID-19 vaccination. Does the county have data-based tools and tactics to facilitate this?
So actually, the California Department of Public Health has been working with other stakeholders in creating resources and toolkits to help with just this piece, for either medical providers or other community-based groups who are wanting to be champions and help nudge behavior. So I think, Dolores, I did try to share a link. And I think we'd be happy to share that with the RCMA members. But there are some wonderful resources, including toolkits, messaging, recommendations, and short videos as well.
And I did post that link in the chat for people who want to click onto it. or copy
Thank
it
you,
and
Dolores.
paste it later.
Thank you.
Great. Jeff, can you give us some update on how many people have been vaccinated, COVID incidents right now, and any deaths in the county, hospitalization, all that?
Yeah, absolutely. So in terms of COVID vaccinations, we're now at over 1.8 million doses. And for those 16 years and up, we're at about 48% of the population that's been partially or fully vaccinated. We now need to change that denominator to include those 12 years and older. For those 65 and older, at least 70 to 72% of our population has been partially or fully vaccinated. And so overall, we're doing well, especially considering that we have a very large what we call quartile 1 population, according to the Healthy Places Index. And that breaks out all of the populations across California into 4 quartiles that are closely linked to socioeconomics. Quartile 1 being the lowest or the most disadvantaged group. So in Riverside County, we do have over 700,000 individuals living in that quartile 1 group, which is the equivalent of taking probably 7 or 8 of the largest counties following Los Angeles and San Bernardino, not including those, but taking the combined total of those quartile 1 populations from many other counties, that still would not equal the number of quartile 1 individuals we have in Riverside County. So, and the reason why that's important is, as you probably, are very aware, individuals who live in higher socioeconomic areas have naturally or have much higher vaccination rates for many reasons. We do have that uphill challenge, but we think we're doing very well for the demographics that we have.
Availability probably is enough now, because I see Hammett Hospital has started a walk-in clinic on Wednesdays and Thursdays from 9 a.m. to 2 p.m. Are Dolores and Dr. Leung, do you have any data, other places where walk-in clinics are there other than the doctor's offices?
Yeah, so there's a surprisingly large number of walk-in, weekend, and all kinds of either permanent or mobile clinics. The easiest way to find that information is either going to the state My Turn platform, or looking up Riverside or RUHS for Riverside University Health System COVID vaccine, which will take you to the Riverside Public Health webpage, and that also shows the links for all of the mass vaccination sites as well as some of the major partners. But we have very good accessibility for vaccine across the county. So it's really kind of just taking the next step and making sure that we can get all of our community members and residents to those vaccination sites.
Dr. Singhvi, we do have a couple questions in the chat. Shall I read them, or would you?
Yeah, please go ahead.
So the next question: people of color show vaccine hesitancy. Any special effort to improve their vaccination rate?
So yes, a big challenge and critically important for our community. Definitely, we are lagging behind when it comes to our African American population. So we do make a special effort to work with our Black and African American churches. We also work closely with the Chamber of Commerce, the Black Chamber of Commerce, and then we've been participating in several town halls, actually, with the NAACP, as well as other groups. So there are also some unions and other organizations that we've done some targeted efforts with, but we still need to do more. So, any ideas that you have or any partnerships that you may be able to assist with, we definitely appreciate it.
Thank you. And then we had a couple people arrive late, and you addressed the CDC no mask guidelines earlier in the, at the beginning, but could you briefly, again, the question is, are masks still required in hospitals and medical offices, and just looking for verification?
Right. So as of right now, masks are still required in hospitals and clinics and healthcare facilities. And we know we've heard a very encouraging statement from the CDC, but we do not yet have published guidelines. And healthcare facilities, including hospitals and clinics, oftentimes do have their own guidelines apart from the general guidance.
And another question, when are we moving to yellow?
So, you know, difficult to predict, but if we had to guess, you know, right now the governor has signaled that June 15th will be sort of moving beyond the blueprint, and we'll have a new framework for thinking about activities and restrictions and sort of precautions that we need to take. Right now, our positivity rate is dropping, is sort of already within the yellow tier range, but our case rate is still a little bit above where we need to be. It's at about 2.5, and our case rate needs to be below 2 for at least 2 weeks. And so when you do the math and look at the calendar, you know, our guess is that if we do move into the yellow tier, it would probably be around the same time as when we're moving sort of beyond the blueprint, as the governor has telegraphed.
Thank you. And it was asked earlier, but I do not recall if you addressed it. Many physicians have called the RCMA office asking, or they're getting pressure from their patients to be allowed to bring additional people to their office visit. Could you address that again if you had already addressed it?
Yeah, thank you, Dolores. So, you know, we do see a shifting in the guidance overall in terms of visitors with regard to healthcare facilities. And, you know, we saw first a sort of a softening with ICUs, with end-of-life patients, and it's just been really gradual from there. Right now, when you look at the guidance for hospitals, for instance, you know, the recommendation from the state is that we still be very careful with people who are positive for COVID. But really for all other patients, so if a patient is positive for COVID or is in quarantine, you know, we really want to avoid any visitors for those patients. But everybody else, you know, the state has essentially said you can start to allow for visitors for all other patients, and then that will be up to your hospital how you do that. And I think that's right, and I think that's a good parallel for thinking about, you know, office practices as well.
Okay. I do not see any hands raised. I'm going to look through real quick to see if I see a yellow hand somewhere. If not, that concludes the questions in the chat as well as the questions that were submitted earlier. So Dr. Cindy, I'll turn it back to you.
Thank you once again, Dr. Leung and colleagues for joining. We look forward to see you again second Thursday evening of next month.